Welcome back to the ABN studio. I am Cheryl Koehn and I'm with Arthritis Consumer Experts. I'm a person living with rheumatoid arthritis. You know that over the last day now, starting yesterday afternoon and up until today, we've met with all kinds of different folks who do different things in rheumatology and for patients, whether they're babies, kids, teens or adults, and on into their olderhood, which is where I view myself now. But we're really pleased to have Dr. Kristin Houghton with us in the studio now. Kristin is a pediatric rheumatologist, is someone that has a specialty in sports medicine, and we're going to talk a little bit about that and how it relates to children with arthritis. She works at BC Children's Hospital and is an investigator in the network of investigators that are trying to come up with answers and solutions for kids living with arthritis. She's also an assistant professor in the Department of Rheumatology at UBC. So she comes to us with many, many qualifications, and we're really, really happy to have you here, Kristin. It's great to see you. It's a pity we have to come all the way to Ottawa to see one another, given we live and work in Vancouver. But we're really happy to have you. We're going to start where I think it's good to start, which is the beginning. How did you get into pediatric rheumatology? What was it about that particular area of rheumatology that interested you, apart from the fact that you clearly love kids and love to look after them?
Pediatrics was an easy decision for me. I always knew I wanted to do pediatrics going into medical school. And then I was the type of resident who loved everything, actually, and I realized that by choosing rheumatology, I was choosing everything, because rheumatology is a multi-system specialty. We collaborate with different subspecialists. I really like musculoskeletal medicine and sports medicine, and my interest in sports and background in sports led me to that. So it was sort of a natural fit.
Yeah. Were you an athlete?
I was.
What did you do? What was your sport? I know that's what I say a million years ago. What was your sport?
I played soccer in university and at the provincial and level as well, and then now I coach my son's 6-year-old soccer team.
Fantastic. Fist bump. Go team. It's interesting, you know, you never stray far from your love of sport, I find, in life. And myself, I grew up playing volleyball, and although I'm not able to play volleyball because of my own disease now, I still feel athletic, and it never leaves you. And I think as a person living with arthritis, our Facebook fans and friends and followers and the viewers here today, Kristin, are really interested to hear what sports medicine for pediatric rheumatology is all about. What does that mean? I know you're having a workshop on this topic tomorrow, is it? What are you going to do in the workshop? Like, help us uncover the secrets of what you do in your world, in your working world.
Sure. So sports medicine is a separate field, and I do have a separate practice in that. And really, I apply those same things to the rheumatology patients that I see. It's about getting kids active who aren't active, so that they're optimally active for their health and their development, and it's keeping kids active. So if they are active and they have an injury in the non-rheumatology world, or if they have a flare of their arthritis in the rheumatology world, getting them back active, and then promoting all the benefits of exercise, and exercise is medicine. So the workshop tomorrow is a little bit different in that it's more hands-on for physicians and reviewing physical exam of common problems that kids have, back pain, knee pain, and when it might not be related to their underlying rheumatology diagnosis, and how we can help those kids. Yeah,
that must be tough. Is it a kid that has a rheumatologic, thing coming up, or is it an injury? I think for kids, I've heard from experts like you that it's sometimes, parents think, oh, Johnny just overdid it on a soccer field, and yet he keeps coming home and complaining about being tired and being sore and having a swollen joint. And how hard is it for parents and you to explain to parents the differences? This isn't just an injury in sport and youth, it's arthritis. Is that a tough conversation?
Often by the time kids get referred to us, parents may have a little bit of a sense.
Okay.
Or we'll see kids referred with knee pain for a few months, for example, and it's clear to us on our history and exam the child actually has arthritis, not an overuse injury of the knee. And there's a big learning curve for parents and acceptance of a chronic disease diagnosis, but it's generally fairly straightforward when we have the proper clinical skills and physical exam skills. And then of course there's kids who have arthritis who get injured. Because there's no injury-free activities.
You can't live in a bubble.
Yeah, you can't live in a bubble.
Yeah.
So we try really hard with our physiotherapists to work on preventing injury and recognizing movement patterns that might not be right in a child who has arthritis.
Okay.
Especially you can imagine a kid learns how to walk when they have a swollen ankle and knee. That is not the same as a child who didn't have those challenges.
Right,
So making sure they're ready for their age-appropriate sports and activities. And our therapists help a lot with that. We really rely on them for that.
At children's?
Mm-hmm.
Yeah. So so parents and their children who are living with a type of childhood arthritis, they do have access to people who are expert at that.
Yeah, so I believe in every province is slightly different, but in British Columbia, we do outreach clinics as well, so that we can serve people closer to home that aren't just right in Vancouver.
Right.
And then we travel with the team, so we have our nurse, our physiotherapist at least, and in Vancouver we have occupational therapy and social work as well.
Right, so this is a really important message I think we're hearing from you, and I hope parents who are watching hear this loud and clear, that there is help out there for you and your child to navigate that whole sport world, an activity. I shouldn't even just say sport, but it's activity world.
Activity, yeah.
And I think parents, particularly what we've heard in our work with Cassie and friends, is parents don't know how much to hold a child back, what is a safe level of activity or exercise, and then when it leads into sport, what sports are safest? Can my child continue to do the right sport? How complicated is it to navigate that?
I think for parents it can be very complicated because there's concern their child might get hurt, but it's not just parents, it's educating the family, teachers, coaches, where I think they're doing the right thing by not letting the child play, but that may not be in the best interest of the child. So we really try to promote kids being as active as possible and doing things their peers are doing, as long as their disease is well controlled. And most families love that because it's normalizing. It's getting their kid active, doing things. It's not taking a medication. It's in conjunction with their medications perhaps, but it's something they can do and be proactive about.
Yeah.
And it's really good for the kids, not just for their bone and joint health, but for their
spiritual, their emotional health.
And development.
And I think we probably don't pay enough attention to that in the adult rheumatology world. I think it's probably a more acutely under the radar, if you will, because we maybe have a bit more time to consider those things for a child, whereas an adult, if you're working, if you're married, you're trying to figure out your family. I have found that those domains you just spoke of, I didn't look after those as well for myself. I didn't seek out perhaps enough counseling in the beginning to take care of the inner me while I was trying to piece together sort of the outer me. So I think it's a really important piece in childhood arthritis is to have that full sort of bench to bedside approach in terms of caring not for the child, just for the child, but for the whole family. And we don't get that in adult rheumatology, interestingly enough. And maybe we should. Maybe we should be looking at your models and going, well, this is something that should be more fully flushed out, thinking of the family, not just the adult patient.
Yeah, and I think play is also integral to childhood, whereas we dismiss it more in adults, where it's very important for adults to have their own pursuits and be active.
Yeah. When you think about the things you've seen, interacted with your colleagues in the hallways and been part of the talks so far, what has stood out for you as a researcher and as a pediatric rheumatologist? Like, what did you have you had any aha moments so far at the meeting?
I haven't had an aha moment yet, but I've been super excited that they had Exercise is Medicine as the keynote speaker. I think that's excellent, and it's arguably the safest.
How'd they do? Did they do a good job?
They did great. It is the safest medication out there, and it's for everyone. It just needs to be tailored and titrated. So I thought that was excellent, and I think that's really moving the discussion forward. There's still lots of research gaps. We don't know what is the best exercise for different types of arthritis specifically or different joints, but we're learning a lot about that, and certainly the benefits far outweigh any potential risks for exercise.
How do you run a study like that? How do you do a study to determine what exercise is the right exercise? Yeah,
and especially if people have different interests, and even in a healthy population, I think that would be difficult. we've done a small study as part of a bigger LEAP study linking exercise and pathophysiology in JIA, which is a nationwide study, a very small exercise pilot for 6 months in Vancouver. Yeah. And it's challenging. It's challenging to get people to do exercises routinely and that are not necessarily fun or super exciting for them, and then to measure bone and muscle outcomes afterwards. Yeah. But it's a process.
Yeah. Yeah. Can you? How would you enroll a child in that? Like, is it tough? Is it ethical? Is getting through ethics more difficult with studies with children? Like, how does that work?
I mean, there's standards for research ethics across the board. And I actually sit on the UBC Research Ethics Board. Okay. But there's different assenting for a child and consenting for an adult. So there's a couple extra steps.
Right. Because the parent or guardian has to be involved in the process.
The child has to agree, but the parent has to sign off. Yeah. So there's an assent and consent piece to it. Yeah. But most families are more than willing to participate in this type of research because it's proactive and may be helpful for their child
and generally safe.
And it's generally safe.
Yeah,
exactly.
Yeah, I mean, I think with drug trials, it's a different story. You know, everybody thinks of the big scary monster that might be the bad side effect. And may steer away from them, but whether it's a medication, trial or an exercise trial, it's so important to participate in research because without us patients as participants, we won't get the answers, and particularly in pediatric rheumatology, you've got a smaller pool of patients. What's the prevalence and incidence of, let's say, JIA, juvenile idiopathic arthritis?
So most experts would say it's about 1 in 500 kids has some form of arthritis. Juvenile idiopathic arthritis is probably more like 3 in 1,000. Some people will say 3 in 1,000 have any type of arthritis.
Okay, so it's not rare, but nor is it super
almost
common.
Every elementary school will have a child. If you look at a medium-sized elementary school, if you put it in that perspective, or certainly every high school. So it's relatively common, but it's very common for families to feel alone because they may not know another family that's in that situation. Right. And so the parent groups and casting friends that you alluded to are super helpful for that and connecting families and advocating for what's important to families.
Yeah, I have to give a shout out to our Facebook audience about Cassie and Friends because I've had the privilege of being at their family day, which they hold annually. They're based in Vancouver. I'd love to see them pop up in every single province because the family day that they host is so powerful. I ooze with happiness when I show up and when I leave because you do see these parents coming together from all over the province and they engage in activities themselves as parents that help educate, support, empower, while the kids go off and do super fun things that they learn are safe to do with their arthritis. They're interacting with other children they may not have contact with regularly or ever throughout the year. So I just want to commend Cassie and Friends for the work that they do, and I know that BC Children's Hospital in your program in particular is very interwoven with their activities. So congratulations to you. Thank you for doing all that. I know you guys give a lot of your time, free time, to that, as well as look after those kids when they're in your clinic. I wonder if you could tell us, as we kind of round up and go out to our audience for a question or two, Kristin, what do you think is the future for kids with arthritis? Like, are there things that we're going to find out relatively soon that will eradicate the disease, significantly alter its course earlier? Are there surgical improvements for children who are now adult, who've had a terrible time because their disease wasn't necessarily well? I know that's kind of a whole bundle of questions in one, but if you looked ahead, what do you see? What do you hope to see, I guess?
Fortunately, surgery is very rare. Yeah. And I've been practicing for almost 10 years, and I've only seen a couple of children with surgery, whereas my older colleagues, more experienced colleagues, have a different history because they were practicing before biologics and other medications were readily available. So that, fortunately, is not a big concern. We're learning more and more about early treatment of arthritis and perhaps treating more aggressively at the beginning to turn off the inflammation. We're also learning more about predicting which children may do well and conversely, which children may not do as well, and that helps us decide when to take people off medications. Because now we have all these wonderful medications that we can get almost everybody in remission. Even within 6 to 24 months from recent Canadian studies, so they're completely fine, doing all their activities, but taking some medications. And then the big question is, can we take them off the medications, and what is the risk of flare?
So tapering and even holding. There were quite a number of studies shown at the ACR meeting this past November in adult populations about tapering, dose de-escalation, I guess, and then widening the intervals that you take them. And the data actually looks very promising. It seems that there are patients you can do that with. So hopefully, I would think that would be music to the ears of the parents who are watching, who do remain, even though they know their child is better on therapy, who still remain fearful for long-term effects of these medications. Do we have any questions from our audience, Anita?
So we have someone asking, because of the weather right now in Vancouver, are there any particular activities or exercises that would benefit children living with arthritis indoors?
Indoors, that's a great question. Swimming is always a great one if you have access to a community center pool or other local swimming pool, because that has, you don't have to worry about the weather, you just have to be able to drive there safely.
And swim.
And you have to know how to swim. Safety first, of course. You need to know how to swim. Otherwise, a lot of the community centers or YMCA have programs for kids. It depends on their age in terms of their ability to participate in those. And then just as long as it's not icy out, like the playgrounds are full of kids right now, running around in the snow, building snowmen. It's hard work running in snow. It's a good workout.
It's hard work walking in snow.
So, taking into account as long as it's safe and it's not icy and slippery, playing outside is fantastic.
I think indoor sports such as pillow fights and things might not be welcomed by parents. But there are also fun things to do in the home, I think. I remember when I was involved in a research project and we were thinking of implementing the sit-to-stand test and how many times you can do it. Actually, we found it quite fun and challenging, and it's aerobic. So there are things you can do in your home that won't destroy your parents' interior of their home.
Absolutely.
I think it's hard, but your point is well made. Bundle up if you can, and try to get outdoors safely, or go inside and swim if the child is a swimmer. And if not, maybe a great opportunity to take a new challenge, learn how to swim.
Or, there's lots of indoor activities one can do, but of course you need resources for some of them.
For sure.
Walls or things, they have fees. And depending on the age of the child, you can do obstacle courses at home, and you can do lots of things. Some older teenagers like the active video games, which are not as good as being...
Like Wii?
Not as good as actually doing the activity, but certainly better than sitting on the couch. So
eating potato chips, which is what I would do. That's great. Any other questions, Anita?
That is all for now.
Okay. Terrific. I just want to remind both Kristin and our viewers that this video interview will remain on the website, so you can go back and visit it if you want a little refresher course from this great content that Kristin has given us. Also, you can continue to ask questions, and if there's something that we can't answer, we would love to be able to just get a quick answer from you and shoot back to the audience.
Of course.
Most of them we've been able to handle, but if there's something very specific, we will get back to you, our fans and viewers and friends. I want to take this opportunity to thank you. I told you it would be easy, and it is. It is very easy. So we want to thank Dr. Kristin Houghton for joining us. I hope you have a great workshop tomorrow.
Thank you.
I know we're going to learn a ton, and I hope you teach us a ton, or your colleagues a ton in the workshop. I think it'll be very, very fascinating to see the outcomes of that workshop. So thank you very much. We can't wait to see you back in Vancouver.
Thank you.